Unless you have VA eligibility, or are retired from the military and have TRICARE for life insurance, or are retired from the federal government and have FEHB benefits, you are going to need a Part D plan for your self-administered medications. And though the government is making progress in improving Part D plans, the truth is some people in 2024 are going to see an increase in their out-of-pocket expenses for prescriptions in 2024. So let me explain the two Part D rules that have changed and how that can have an impact upon you. Now, as I get into those changes, I want to just begin by talking about some of the components of every Part D plan. And first off would be the formulary. And the formulary really is the most important part of a plan. It's truly not the cost of the plan, it is the formulary. You want to make sure that you have a plan that's going to cover your medications. And so a formulary is nothing more than a list of the medications that plan is covering. Most plans are going to cover anywhere from about 2,500 to 3,500 medications. So formulary is number one. Secondly, every plan is going to identify a couple of pharmacies that would be an option for you that are called preferred pharmacies. And usually it's maybe 2 or 3 different pharmacies. Could be CVS or Walgreens or Walmart or Costco or Sam's Club or some grocery store in your area. The rest of the plans that are not preferred are going to be called standard pharmacies. And again, you can go there to get your prescriptions, but as a general rule, you're going to pay a higher price at a standard pharmacy. Number 3. We're going to have what we call utilization rules. And these are really management tools that every Part D plan can use to be able to save money. And that would be not only money for themselves, but also for you as well. And so what we have is every plan is going to identify some medications that are going to have what we call quantity limits, which means there can be only so many pills in the bottle. That could be 30 pills, it could be 90. But the point is not everyone is going to get a 90-day supply for their medications. Medicare will not allow that on addictive meds as well as expensive meds. Quantity limits exist within every formulary. Also, we have a thing called step therapy. Step therapy means that you have been prescribed a medication that's expensive, and there are some generic equivalent or generic lower cost medications that you're going to have to try to use first. Now, if you've used those already and they're not effective, then the doctor can say so on a form, and they'll probably go ahead and fill the brand name right out of the gate. But if you haven't tried those, then you're going to have to try the lower cost medications first, and they will step you up to the brand. So it's going to take a period of time before they'll fill that medication. And then lastly, there are some medications that are called prior authorization. That means that plan is not going to fill that medication until the doctor has justified why it is that you need that medication. And again, these are expensive addictive medications, so the doctor is going to have to be involved in some way with that. Now, the fourth component would be switching plans. The good news about drug plans is that they're just 1 year at a time. So if someone's on a drug plan anytime between October 15th through December 7th, they can switch the plan and their new plan goes into effect January 1. So the point is drug plans are 1 year at a time. It's a calendar year, switchable with no underwriting. So if that drug plan is in your zip code, you can get it. There's no health questions asked, no underwriting. If it's available, you can enroll in that plan for the beginning of January 1. All right, so that's the way that works. And then lastly, we'll talk about phases. And I have another kind of detailed slide because this is really what has made some changes where some people are going to have to pay more money in 2024 than they would have in 2023. Now, let me explain the phases for those of you that are new to Medicare. What this means is that we could be on one medication that potentially could actually change our out-of-pocket expenses 4 times in the same year. Same medication, and so what we have is fluctuating copays because we have 4 phases on Medicare plans. Now, to kind of wrap your mind around this and make a comparison, the group plan that you've been on at work or an individual plan that you bought didn't have 4 phases, it had 1. Medications covered, it's given a tier number, and the tier number tells us what the copay will be. So a tier 1 may be a $2 copay, tier 2 may be a $10 copay, tier 3 $50 copay. But if you're on a group plan or an individual plan, it is a fixed copay all year long. So it wouldn't matter if I got my prescription in January, July, or December. On the group plans, we had a 1-phase plan. We had fixed copays all year long. But with Medicare, at least for 2024, we have 4 phases that someone can go through, and that's why the copayments are going to fluctuate. All right, so these are components in all drug plans. Now, let me share those with you. But before I do, I want to remind you, there's 2 ways in which we can get drug plans if we're going to get a Part D plan. Now, again, if you're a veteran getting your meds to the VA or TRICARE for Life or FEHB, you have credible coverage already. You don't have to have a Part D plan. Everybody else is going to need to. So we get them one of two ways. We can buy a Part D plan as what we call a standalone drug plan. Standalone. And this happens when someone stays in original Medicare A and B and gets a supplemental plan, then they add a prescription drug plan to that coverage. Another way we can get it is it can be included within an Advantage plan. So Medicare Advantage, it takes care of our inpatient and outpatient stuff with a private health insurance company, but we add a prescription drug plan to that, so we call that an MAPD. So it's included or integrated. So they've added that as part of your Medicare Advantage plan. Up here, you got to select a plan based upon your meds, the pharmacy choices. Down here, they embedded that, and hopefully it's going to work for you. Okay? Or if you're a veteran, or TRICARE for Life or FEHB, you actually can just get what we call an MA only plan. A lot of people do that. Why? Because again, they're going to get their prescriptions to the VA through TRICARE or through FEHB. They can get an MA only plan. That's the only people that should get an MA only plan if you decide to go the Medicare Advantage route. Okay, so my point is this. So we can either get it here, standalone if we have a supplemental plan, or we include it within the Medicare Advantage plan if we need to have that Part D plan. All right, so now let's get into the phases, and let me explain the changes that are occurring from 23 to 24 and then gone into 25. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so we always start the year off in the first phase, which is called the deductible phase. Now, Medicare sets this deductible. Now, by the way, I'm shooting this video January the 9th of 2024. But the reason that I have 2023 up here is because some people are actually seeing an increase in the cost of their, out-of-pocket cost for their Part D plan. So let me show you why that is, and then again, we'll look at 2025. So we begin the deductible phase. In 2023, the deductible was $505. In 2024, it's $545. Now, what this simply means is this. When we're in this phase, we actually pay 100% of the cost of the medication. So I put down here on this slide the 4 different participants in a Part D plan. And so this would be the person who enrolls, which would be the patient, the Medicare beneficiary. In this phase, you are 100% responsible for your meds. And so for many people, their meds are very inexpensive. They may have a $4 copay or $8 copay or $2 copay. Some tier 1s are 0 copay. But the point is, while I'm here, if I'm making a copay for my medication, that copay is typically going to be applied to my deductible. And now there are some meds that are very cheap or even 0 where they're deductible exempt. But if I am on a medication that is a tier 3, tier 4, tier 5, which are going to be brand name medications up or non-preferred generics, what happens is I'm going to pay a copay, and that copay again is applied to my deductible. And all I'm trying to teach you is in this phase, you're responsible for 100% of the cost of your medications. All right, now, many people are on low-cost medications, and they will never, ever even reach that deductible. So if we don't reach that deductible, then we just stay in this stage all year long. Now, there are actually some plans that actually reduce this deductible. It may be $350 or $200. Some plans bring it down to 0. So either if I satisfy my deductible or I don't have a deductible, then I would immediately go into stage 2, which is called the initial coverage stage. Now, what happens here is now you as the patient, you're only responsible for 25% of the cost of your medications. That's it. And that Part D plan that you bought is now beginning to participate, and they're actually going to pay 75% of the cost of your medication. So that if that medication is $100 retail, you paid $25 and they paid $75. Now, I'm not trying to confuse you, but I do want to clarify something. Sometimes in this stage, we will see a plan set a copay as just a flat dollar amount. It could be a $45 copay or a $50 copay, and actually out of pocket could be less than 25%. But they can't make your copay be any any more than 25% in this particular phase. It's just not possible. It's not legal for them to do that. So the most we'd pay would be 25%, and they pay 75%. Now here's where things are different on Medicare plans than group plans that you've been on or individual plans. What happens is Medicare, in all these two first phases, they're tracking the retail cost of your medication. The retail cost. You didn't pay retail, you met your deductible, and here you just paid 25%, but they track full retail. So if our retail ever reaches a certain total, Medicare calls this a threshold. In 2023, it was $46.60. Now watch what happens. And into 2024, this year what happened is I'm still responsible for 25% of the medication, and the plan is still responsible for 75%. That didn't change, but what changed was the threshold. So our threshold in 2024 is $5,030. So let's go back and talk about it. So here what was going on, they tracked retail. So what that means is every time I get a prescription, I paid no more than 25%, plan paid the other balance of 75%. But if my retail total ever reaches that, then I would be done in this phase, and I would go to phase 2, which is called the coverage gap. Layman's terms, this is what we call the donut hole. So yes, the donut hole still exists. It'll be gone in 2025, but it still exists in this year and last year. And so my point is they're tracking the retail cost of medication. So what happened is this: when they raised the retail threshold over here, about $500, not quite, but close to $500, I'm still responsible for 25%. So this would have increased my out-of-pocket costs for maybe $100 or so into 2024. I had a little bit of a higher deductible by $45, and I'm in this phase for just a little bit longer. And so let me explain this. When it comes to this retail, as they track the retail, every time we get prescriptions, this number is growing and growing and growing. And if it ever reaches that number, then I'm done in this phase. Now, the truth is they say that less than 10% of all people ever reach that retail threshold. So that means less than 10% ever go the donut hole. But if we do reach that retail threshold, now we're going to the donut hole. Now in the donut hole, what happened last year, we would pay 25%. Now this would be a hard cost. Remember up here I said the most they can charge is 25%. Sometimes they charge less, but here they will charge 25%. So what happens to cover the full cost of medication is this. You, the Medicare beneficiary, paid 25%. The Part D plan only paid 5%, and the reason for that is because the manufacturer now comes into play, and that manufacturer had to discount that medication 70%. And so what happens here is we have a different threshold. This was retail threshold. Now we have another one, and what it is called the true out-of-pocket threshold. True out-of-pocket. And that last year was $7,400. And again, what's happening as we get into this year, same thing applies. 25% by you, 5% by the plan, 70% by the manufacturer discount. But in 2024, we have an $8,000 true out of pocket. So it went up. And again, you're responsible for 25% of that. And so what happened? It's going to be that $600, 25%. It's going to be $150 more out of your pocket. All right, so let's get back to this. So this true out of pocket, what this means, it means everything that you have spent. So your 25% coinsurance in the gap, your copays here, which were up to 25%, plus your deductible. And once we got to that $7,400, what's also included here is the manufacturer's 70% discount. So 70% of that money is not yours. At the most, 25% of that is. So what's that going to be? About half of that would be $3,700. So about a quarter of that, then we're talking, a couple $1,000 out of your pocket. You did not spend that at all, but they've been tracking that. The total retail cost, including the manufacturer discount, is applied as though it came out of your pocket, even though it didn't, okay? And so my whole point is this. They, in 2024, raised that to $8,000 again, so it'd be everything you paid in stage here, 25% here, plus your deductible once it gets to $8,000. Now, here's what happened. Last year, if I got to this retail threshold, I think they say about maybe 1% of all people do. What would happen then is I'm in catastrophic. So once we've reached that $7,400 true out of pocket, now we're going into the catastrophic phase. So 2023 last year, we had a 5% co-insurance that we were responsible for. Now, no big deal if you're on a medication that retails for $100, that's $5 copay. But if it's $1,000, now it's $50. If it's $10,000, now it's $500. So the whole point is people could spend a substantial amount of money if they're on real expensive medications. Now, what was happening here is this. 80% of this was paid by Medicare. So here we see Medicare get involved in the game, and they pay 80%, and the plan that you're on, that Part D plan, had to pay 15%. So that's, again, how we get to our 100% retail. So as we move into 2024, what's happening is this. This is the great news. Now we get to catastrophic because the Inflation Reduction Act, and we get here now, we have zero out of pocket. So what they're saying, all of this year, the most someone should expect to pay out of pocket totally in these three phases is about $3,350 maximum. Okay, now because of the reasons I just showed you, we may spend that money a little bit faster, but once we have reached $3,350 out of pocket, then that's going to be the cap for 2024. Why? Because the catastrophic has gone to zero. So what's happening is this. What they did is this. Medicare still pays 80% here. Remember, you pay zero, and then the plan that used to pay 15% now has to pay 20%. And that's why we saw some Part D premiums actually increase as we move from 2023 to 2024. I'm saying some of the Part D premiums did go up. All right, so that's how it's going to be structured 2024. Let's quickly just explain what 2025 is going to look like. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner, and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions, and they'll show you different Medicare options to make sure that you're confident in the decision that you make. First off, they set the deductible at $540. Nothing has changed here but the amount. You are still responsible for 100% of the medications until you've reached that deductible, whether it's the full amount or a reduced amount. And then once we've done that, again, we're going to initial coverage stays. And again, you're going to pay 25%. Manufacturer now has to discount 10%, and plan is responsible for 65% in this stage. So now we got the manufacturer involved a little bit quicker. But here's the good news. Now in this, we have a cap. So yes, I'm paying 25%, but once I have spent out of pocket $2,000. Now that doesn't include premium, but it does include out-of-pocket expense deductible. And once I've got to $2,000 in 2025 moving forward, that is the cap on our medications. You don't have to spend anything else whatsoever. And so the reason for that is this. What has changed is kind of some of the way these other participants are now going to be responsible. So here's what happens. Once I've reached the cap, you're basically in the catastrophic phase. You have zero responsibility. And so what's going to happen is this. If you're on a brand name medication, the brand name, the plan itself has to pay 60%. The manufacturer must discount 20%, and Medicare will now pay 20%. Look over here. Medicare used to pay 80%, but now they're just going to pay 20%. And that's why we're not sure what's going to happen with some of the Medicare Part D plans going into 2025, because they took on now 60%, where before they had a very little responsibility in catastrophic. Now, if it's a generic medication, plan still pays 60%, manufacturer doesn't discount, and then Medicare will pay 40%. Again, though, Medicare was paying 80%. Now, either 20% on brand or 40% on generic. So they have drastically reduced the government spending on Part D plans. All right, so hopefully all that makes sense, but we have these phases. But once we get into 2024 is still good because we eliminated catastrophic, but 2025 will even be better.